Hi guys, I hope you're all well. Today's video is going to talk to you about back pain. So I'm going to run through the main kind of common causes, the exercises and stretches that you can do at home to help you, and then the general tips and tricks regarding posture, desk setup, sitting to help you. Firstly, my surroundings. We're currently in lockdown, so it means that my office is my garden, so enjoy the sounds of the birds and the greenery. Firstly, back pain. The most common cause that people come to me with is when they're sat down at their desk all day. So if we are hunching forwards, you're going to see that your shoulders and neck get tight, but also it creates a curve through your low back, and that's going to cause an aggravation as well. So I'm going to talk to you about desk setup and what you can do to kind of open up your posture essentially. The same thing when you're sitting on the sofa. So we tend to slouch, we tend to kind of lean towards one side. That's going to switch the muscles off. So then you're just relying on your ligaments, and then when you stand up, there's a delay in the muscles activating, so you can feel that you're catching something. So it can feel like quite a sharp pain as you get up, or a dull achy across. So I'll talk to you about sitting in general. Training, so in the gym, if you're doing something not the right posture, if you're kind of hunching forwards, again it's going to cause a tightness. Then walking around, if you are carrying a bag on one side, or if you're a manual lifter and you're kind of always digging the same way, it's going to cause a tightness on one side than the other. Essentially the pelvis is going to be pulled up, there's going to be a tightness through the QL, so through your back muscle, and then through the pelvic muscles, which is going to cause it come up and in. So what we want to do is relax it down again, essentially, to make it stable. They're the main kind of causes of low back pain. You can just be generally stiff. If you're sat down a lot, or if you're not as mobile, or not moving as much as you usually are, that can cause irritation. You could have caused an injury in the gym as well. All these exercises are going to benefit you. I would say there's none that you can't do. If you're experiencing kind of numbness, tingling, nerve or disc irritation, you may find these a little bit more tricky. Listen to your body. If it feels good, do it. If it feels uncomfortable or not quite right, then hold off and send me a message, and I'll see if I can help you further. Enjoy the video. I hope you like it, and I hope it's helpful. If it is, please let me know. Please subscribe as well, and yeah, I'll crack on with the video. Thank you. The simplest and most beneficial for my patients is going to be your sitting. So if I'm working at my desk, I'm going to be thinking about my posture for 2 minutes, and then I'm going to be either hunching forwards, leaning, bending over, or I'm going to be sat back in my chair, be comfortable for a little bit of time. Then you're going to stand up and you're going to get back pain. So the first thing you want to do is to get rid of this curve. So we're going to sit as far back in the chair as we can, grab a cushion, put it in the natural curve of your low back, and sit against it. And what it does is it neutralizes this curve. So I'm straight. I'm not doing any effort, I'm just holding myself here. What I can then do is just shoulders down and back to make sure I'm comfortable. We do this when we're working, but also when we're driving, just on a plane, when you're traveling, in the evening on the sofa. Instead of hunching backwards, pop something there to stabilize you, and you're going to feel the benefit. Then desk setup. So bring yourself as close to your desk as you can. Have that cushion there. Everything wants to be 90 degrees. So say you had your laptop and it was too low, just raise it on a book so you're higher up. You want all of your screens to be 90 degrees, so I'm looking here. So if it's too low, just raise it up on a couple of books and you're straighter. If you're quite short, you can prop your knees onto a little stool or something just to kind of help stabilize you. The most important thing is sitting with something behind your back, bringing yourself as close to your desk as you can, and then just raising everything up on a platform so it's more comfortable and you're not having to lean forwards essentially. So posture is the next thing for back pain. So if we're hunching forwards, we're going to get pain through here, but also pain through here. So imagine if you're hunching, you can imagine why this is going to start pulling. If it pulls up through here, it's going to create more tension through there. So the exercise, feet shoulder width apart. You suck your bottom in, so you neutralize the spine. So if you're out here, it increases the amount of pressure going through your spinal joints. So you suck in, you engage your core. You roll your shoulders down and back. Have your hands out to the side just to help you with the exercise. And then your neck, you lift your head up. And the exercise is you give yourself a double chin backwards. And you notice that my neck, so my ear, is in line with my shoulder, hips, knees and ankle. I'm in spinal neutral. Hold it for 20 seconds. So we're just holding it here. Focusing on breathing and focusing on squeezing your shoulders down and back. Then you relax. So I exaggerate, but imagine you relax down to this. We do the same thing. Feet shoulder width apart. Suck your bottom in, shoulders down and back, engage your core, head up, chin back. I'm still looking straight. My head isn't like this, it's not like this. I'm and just up, and bringing it back. So imagine the string lifts you tall, and then you literally just push your head as far back as you can go to take the pressure out of here. So feet shoulder width apart, suck your bottom in, shoulders down and back, hands out to the side, have them open, head up, and give yourself a double chin. And you hold that at least 4 or 5 times through the day, 3 rounds in one go, so it's 3 lots of 20 seconds, so it's a minute, 4 or 5 times through the day. Posture is the key for anyone, because you can then combine this to when you're sat down. So instead of hunching forwards, you keep yourself tall when you're sitting. If you can change your posture, all the other issues are going to resolve by themselves essentially, so it's important to do. First one is sat down, so you want to sit as far forward on your chair as you can. You want your legs to be really wide. You put your elbows on your knees. This is our start position. Cross and grip onto your opposite foot. So you're going to be stretching through here, and you'll also feel it in your lats through here as well. So you come forward, grip onto your foot, and then you pull back. So I'm pulling back against my foot to get some resistance, and I feel it through here. So then you can do the same on this side. So what you're looking at, my finger is gripping my foot, I'm leaning forwards and I'm pulling against it. So if you don't feel it, have your legs wider, come across, lean your body forward. So I'm actively stretching into it a bit more, and then pull back. So you're going to feel it kind of all the way up through the shoulder and into the low back. So come forward, stretch, hold it for about 10 seconds, then make your legs wider again, do the same thing. You can also just walk your fingers forwards this way, and the same on this way, just get the stretching there. 5 to 10 times, holding it, okay? So it's not a bouncing, it's a hold. Instead of doing this, you hold as it eases, go a bit further forwards. Next stretch is the same thing, so legs wide, walk the fingers through the middle, so you go as far forward as you can. You'll feel the stretching along the centre of your low back. As it eases, go a bit further again. Hold it as it eases, go further. And the key on this one is put one hand over the other. So my right hand goes across, and I feel that stretching on my right side. As it eases, go a bit further forwards. Then do the same on this side. Do this all with breathing. So as you breathe in, as you breathe out, you stretch. Walk your fingers forwards. Walk them again in the middle. Same again, stretch across and across. If you feel it pinching in your hips, have your hips wider. It's because your hip flexors are tight, but I'm going to make another video on that one anyway. This is all about the angle of your body, so you want to go push your bum back. So imagine you're closing your cards all with your bottom. You then stretch horizontally across. So I'm 90 degrees, I'm stretching across. I'm going to feel it all the way up through here. Same on this side. You can just relax your arm on your thigh, stretch across. You'll feel it stretching through here. So you see how I'm 90 degrees and I'm pushing my bum back. You can grip on something, so imagine you're holding onto a door or something in the gym. Grip, pull against it to get more of a pressure, and then really stretch forwards. Same on this side again, come around, stretch over, really overreach, make sure you're really trying to stretch it. Again, it's not a bounce, so you're not doing this, you're holding and stretching. Good. Then the next one, so it's all that angle, so instead of being like this, I'm going to be like this. So I'm still leaning forwards, and then I stretch up and over. So you're opening up your lats through here. Again, really reach, imagine you're gripping on something, stretch forwards. Same on this side, I'm even going on my tiptoes slightly just to get more of an angle. Reach it high, all the way through here. So if you don't lean forwards, if you just do this, you don't feel it. So you need to make sure you lean forward slightly, stretch up and over, really grip forwards. Good. The 3 that I've just shown you, you can do as a progression, so you can do one after the other, or you can just pick and choose which ones you do through the day. But these are really good for just lengthening out the QL and the erector spinae and the general connective tissue in your back.